button now.
All right. Hello, I am Deb Stidham, and I serve as chair of the Addiction Counseling Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I'm going to ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. So I don't believe Jacqueline's on, and Christina is not on, and Lisa is not on. Jason.
Deb, sorry, Lisa is on the phone.
Oh, she's just on phone. Okay.
Mm-hmm.
So Lisa, you want to acknowledge yourself?
I'm here.
Great. I see Jacqueline logging on. Jason.
Here.
Shane. Michael.
Here.
Dulcinea.
Here.
Is that Dr. Rakestraw now to you?
2 more weeks and then it will
2
be
more weeks. Okay.
October 7th.
I won't remember. I'm just kidding. Sana.
I'm here.
All right.
She is Dr. Shook.
Oh, well,
This is
my
her
apologies.
PhD,
I
so-
did not know. Let's see if I can remember that one.
I'll put it in my header.
I don't know you quite as well as I know Dulcinea, so I don't feel quite as free and just teasing the heck out of you, but
I welcome it.
okay. And I'm Jacqueline. I see her. Bright,
Hello.
shiny face.
Sorry, I'm late.
You're fine. All right. So I'll let David introduce who's on the call, and I'll let him read a message concerning this meeting being held remotely.
Thank you, Deb. Members of the Bsrb staff who are on the Zoom call include myself, David Fye, also Leslie Allen is in attendance, the Assistant Director and Licensing Manager, Ashley Van Buskirk, our Senior Administrative Assistant, and also Sammy Barksdale, who's one of our licensing specialists. And so we have 4 members of our staff on the call today. And I'll go ahead and read a little bit about this open meeting. I am, as I said, David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as no individuals requested to provide public comment. Because we are conducting the public meeting remotely by conference call and other teleconference ability, I state for the record the following information. The meeting is being conducted remotely. However, access to the meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is being conducted remotely, the requirements of the KOMA are not suspended. As such, we will be conducting this meeting pursuant to KOMA. On July 1st, 2021, we sent notice of the advisory committee meeting to all individuals who had requested notice of the advisory committee meetings. The notice was also posted on the board's website, asbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials is posted on the board's website and was posted earlier today. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240. And currently, the best way to contact the board office, given our direction from the governor's office to have remote staff, primarily would be to send an email to the BSRB inbox, and that's bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting, and you can use the link which is posted on the board's website in terms of the notice for the meeting. And Deb, I want to let you know, Shane Hudson is logging into the meeting right now.
Oh, fantastic. Okay, so hopefully everyone received all the materials, including the agenda. I have one addition to the agenda, which is something Leslie brought to my attention about some language and regulation. And Leslie, remind me which section that's under. well, you can tell me when we get there, but anyway, it's a clause we put in there at the beginning of the entire launching of the profession to allow people who had received their hours back before 2011 to be able, because a lot of supervisors retire or whatever, and so they could use basically someone else who could attest to the fact that they did their practicum hours if they weren't able to get that. So the question is whether we want to continue that. So that's on the agenda as well. Looks like the first thing on the agenda is to review and approve the June minutes. And while we're considering that, I just want to say to the BSRB staff that these minutes were very, very helpful to me. I would give them like the A+ star in helping a mature chair remember things that we discuss from meeting to meeting. So extremely helpful in preparing for this and helping me understand what we've already talked about. So kudos.
Deb.
I don't see anything for correction, so I would move that they be approved as presented.
Do I have a second?
I'll second that.
Any other discussion? All in favor, say aye.
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 Any opposed? No opposed? All righty, thank you. New business, so,
Deb,
yeah,
I have your section if you're ready.
well, we can just, we can get
Oh,
to
you
that.
just want it when we get there? Okay.
Yeah, I just didn't know which, and your
Okay,
website's down, so I had a hard time looking up.
still,
Yeah, well,
Ashley's been working and working and working to get it back.
yeah, it's frustrating. I
Together.
know. Okay, so applicants for advisory committee. David
Deb.
sent out,
On the agenda, you had a line for the executive director's report. You want me to provide just a brief update or?
okay, I didn't mean to go that fast. Yes, please.
Great.
Sorry.
No problem. Just a couple of announcements I wanted to make to the advisory committee. First, as the chair mentioned, our website has had some issues over the last couple of days. This is not unique to the BSRB. There was a rollover of Sitefinity hosting a number of the state websites, and in the rollover, some of the data from the last couple of months was removed. So we are in the process of reposting that and correcting links that were broken when that rollover occurred. So our goal is, and we hope to have that all corrected by Monday. But there's quite a bit, and Ashley Van Buskirk is doing quite a bit of work to that. So applaud her work, but this was unexpected. We were told that there would be no data that would be lost from our website, and unfortunately that was not the case. So we're doing some cleanup work, but we hope to be back to normal by Monday sometime. Another announcement I just wanted to make for you all is that there is a new chair of the board for the BSRB. Deb Stidham did go ahead and step down as chair of the board, and the new chair of the board is Leslie Seawester, who had previously been the vice chair for the board, and the new board vice chair is Dave Anderson. So we're excited to work with both of them and wish them well in their new positions with the board. Also wanted to make you aware of there was a previous executive director of the BSRB, Mary Ann Gable. She had served the BSRB for about 20 years, from just about 1980 to about 2000. She unfortunately did pass away on September 1st. So we sent some flowers to her visitation on behalf of the BSRB. This past month has been very busy in the office. All state agencies were asked to submit a budget by September 15th. So we did go ahead and submit a budget and also performance measures for the agency. And that includes the budget for this current fiscal year, which this is state fiscal year 22. And also we submitted a budget for the next fiscal year 23. In general, we don't expect there to be large increases, but there are some new costs. And so we've made some adjustments, but overall things should stay fairly close to what they have been. We were also asked to submit a strategic 3-year IT plan. And so we did work on that and submitted that with some changes we hope to take place in the next few years for the agency. One item that you may encounter as you work with our office, the governor directed state employees to return to primarily working from home as of August 25th. Most state agencies had employees working primarily remotely from the beginning of the pandemic through about the beginning of June. June 14th is when they had all state agencies return to having most employees back in the office. Unfortunately, based on the COVID variant, they had us return to primarily remote work as of that date. And then yesterday we received a notice from the Department of Administration that the governor had extended that. And so it is now effective through the end of October. So that means we do still have the board's office open, but we have as few members of the office as necessary to keep operations going here. Staff is working remotely. When we got that direction, we did make some additional purchases for equipment for staff to try to help keep things as close to possible, but it is still challenging with staff working remotely. We did have a member of our licensing team resign about a month ago. So we have been advertising a position for a senior administrative assistant position. That advertisement closed yesterday. So we should be getting a report from the Department of Administration with applicants. We'll be setting up interviews and then beginning the process of hiring and then training that new individual and getting them up to speed. We are also working on creating the new position and bringing somebody on board for the passage of House Bill 2066, which has to do with the expedited timeframe of military licensure. That process of creating that position has been pretty complicated. And so it is possible that in the individuals we interview for the senior administrative position, we might be able to offer someone who was not the selection the possibility of coming on board for that. So we're hoping to maybe bring 2 people on board during the hiring process. So hopefully that will work. Another thing I want to make you aware of is there were 2 different boards that started up this past summer. One was the Kansas Fights Addiction Grant Review Board. That is the product of a bill that was passed by the 2021 legislature that has to do with some funding from lawsuits being used in a new Kansas Fights Addiction Grant Fund. And individuals with different programs can apply for some of that funding. That is through the Attorney General's office. The Bsrb was added in the bill to have a representative as part of that board. I've been in contact with the Attorney General's office. They have not scheduled any meetings yet, but we will keep you informed as that group begins to meet. But as of right now, they've had no meetings. The other group is an Overdose Fatality Review Board, and that is the product of Kansas Department of Health and Environment, KDHE, receiving a grant from the CDC to review fatality cases involving overdoses. And they have had 2 meetings so far. I've represented the agency at those meetings, but they are still in the planning process and trying to determine what role they want to play in this process. So I'll keep you informed as that group continues to meet. But with that, I will go ahead and end my report and answer any questions if there's any questions.
Okay, David, thank you. Now we can move on to new business, applicants for advisory committee. So hopefully you've had a chance to review those resumes and letter of interest, and also the materials that David sent out in regard to kind of the process and kind of what we're looking for.
And Deb, would you like me to go over any of that information in terms of what criteria the advisory committee is asked to look at when reviewing these applicants?
Sure.
Okay. Well, as the chair mentioned, I did send a document which summarizes the advisory committee recommendation process. A lot of this language is from the board governance policy and also historical practices by the Bsrb. One thing on that document that I just wanted to direct your attention to, the document indicates that in terms of the structure of the advisory committee, there will be a professional member of the board representing that profession who is the chair of the advisory committee. There is another public member of the board, and then it mentions that there is a minimum of 3 additional members of the advisory committee, but it doesn't actually say a maximum. Currently, there are 7 non-board members that are on the advisory committee. So I wanted to let you know what the current number was for that. In terms of the terms, those are 2-year terms, and advisory committees can serve no more than 4 terms. And it's recommended that those terms be staggered. In terms of the selection process, it does indicate that those conversations on the nominees, or it says that anyone can nominate themselves for consideration. The process we used was we sent a letter out on behalf of the Bsrb to licensees, and then we gave them a window of time to submit resumes and letters of interest if they wish to be considered. And so when we received those, we went ahead and collected those, and we had forwarded those for your review. In terms of your process to review those individuals, the language in the governance document talks about the advisory committee should work to ensure that there is representation based on geographical, gender, and public and private settings. The members should provide representation of the levels of licensing for the discipline, and it is suggested that those members be selected from among public and private practitioners and educators. There's also a line in the governance document that was included in the handout you received that indicates the policies and procedures under which the BSRB board members are expected to operate will also apply to the advisory committee members. So in terms of the ethical standards and the other standards that you would expect from board members, you should use that as a factor when evaluating individuals to serve on the advisory. In terms of the process, those discussions will occur in an open meeting of the advisory committee, and you will look at the materials that they submitted. It is asked that you reach recommendations on which members you would believe are the best suited to be added to the advisory committee. And then those recommendations are forwarded to the chair of the board. It indicates that the person who has ultimate authority to add members to the advisory committee is the chair of the board. And then when those recommendations are submitted, the chair can request additional input. And then those would be considered at a board meeting to be added to the advisory committee. And then any members that are added, the executive director will inform that member that they have been appointed and then work with them to try to get them up to speed on the advisory committees. So just wanted to walk through those items and make you aware of what the document had said about the process and what they're looking for.
Great, thanks. So I would suggest that we consider 2 folks out of this group. I was looking at the terms, and I've sent that out periodically of when folks start, and kind of now that I'm more cognizant of this end date of 8 years, my new document has, that projected 8 years, which is kind of humorous, but time flies. So for example, Lisa Carter can serve till
I'm sorry, Deb, I think your connection froze.
2020. So I don't have anybody that, oh, nice.
Okay, I think you're back
Yeah,
now.
it says it's unstable. I might have to go off video. So we haven't had anybody start in 21. So I think it's good to have that kind of rotation for the initial 2 years to keep it staggered. So I think 2 is a good number. Unless we feel strongly about 3, I think that's fine too. We did talk, David, about 3 years ago as a board, but it wasn't memorialized to kind of hold us to 10 members. I think that's a good number. So anyway, where do you want to start? Does somebody want to just say kind of your priority? Like
I can start a little bit. I spent some time on the resumes and that you answered the question that I had coming into the meeting is how many people do we think we need to add? I don't know why I had in my head 2, but for some reason that's what I was thinking. So, geographically, there are a couple people here from outlying counties that might be smart to consider. I don't like to be too critical of things, but a couple of the resumes didn't necessarily give me the information that I would want to know about them just in general. One of the outlying community members, I don't have a current employer on the resume, which I thought was very strange. But we do have one from Southeast Kansas. We really don't have any representation from that area of the state. And my suggestion would be that we take fairly strong consideration of that, given what some of the trends are that we see down in that area. And then I know Mike is a fairly recent addition in Kansas City, and Lisa's a fairly recent addition in Lawrence, and I'm going to be probably one of the first of this group to be the next one to go off of this committee. So I don't know what that means in terms of representation up here. We have 2 from the Wichita area with a third that's applied. We have 1, with Shane and Salina. So my initial thought is to look at Southeast Kansas as an area, geographical area of the state to add. And so, those are just my initial thoughts, and I'm open to the rest to see what other we would want to add.
So you didn't have a strong second, Jason?
I don't have a strong second, to be honest.
Okay.
Just that first one, I think, makes sense to me.
Okay. Others?
I would agree that I think that geographical representation is good. I've actually known Charity professionally for several years now. She worked here in the Wichita area for a while before moving to Southeast Kansas to, I think, originally work for City on the Hill when she got there, and then transitioned to KISA. So I also personally think she would be a good addition. I also worked with Chad Jacobs here in Wichita, supervised him for a number of years and have worked around him, and so also know him pretty well. And he's a great professional who is not at a leadership position, right? He is a worker in the field, and that might bring a different type of perspective to this group as well, since most people are kind of at a different level. So that's something to kind of consider. And then I looked at the others. I was also interested in that one that didn't have a lot of information in the resume, but also from Southeast Kansas. And then, yeah, the Topeka and Kansas City areas. So.
Okay. So
I'll
go ahead.
Those were my top 2 choices as well. The 2 that Jason and Dulcinea just discussed.
Okay, thank you.
I agree. I like the geographical spread and representation, getting Southeast Kansas involved. And I also like the idea of having someone involved who is providing services directly to patients and not necessarily on an administrative level.
I was going to say, I'm going to agree with that. I think making sure we have that representation from those other parts of the state that are historically so underrepresented in these things, including, just people even working out there sometimes, that would make sense as a big piece of part of what we consider there. And I didn't see anything that flagged me as concerned about any of those that were from that part of the state, for sure. I don't know any of them, so I don't have any experience with them.
I can tell you that Charity was recommended by Steve Brazil, who's a prior member of this group and works for KDEDS. Sana? Jacqueline, what's your thoughts?
I agree that looking at the geographical part makes sense, and it coincidentally is even gender wise that way as well. So I think those make sense to me as well. And I had not noticed, I had not caught the difference about the person who's not in the administrative role, but I can definitely see that is a plus. And so that would be a welcome voice.
Yep. Well, I concur. So unless there's something else we need to discuss, I think we can forward these to the chair for recommendation.
I would just say, can we keep these others on file, so to speak, for next year as people do go off and we need to consider? I don't necessarily see anything that precludes anybody. We appreciate the applicants, but.
I agree. In case one of you decide you've had enough fun, want to bug out.
I
So
say,
just to make sure we're perfectly clear, so the two individuals that would be recommended by the advisory committee, I understand right, that would be Tina Palmer, is that right?
No, Charity
Charity, okay.
and Chad.
Charity and Chad,
Yeah.
okay,
Yep.
great.
You guys are efficient, quick.
I
All
think
right.
before we move on, Deb, one thing to potentially consider when we need the next one would be, I think, am I the only educator left now?
You are.
Because I was gonna say, I know,
Of course, we didn't receive any resumes of interest. If you
right, and I
know-
didn't see any. I'll see
Yeah.
if I can think of some of the other ones that.
Yeah, I was
maybe-
gonna say, I think that works, equally well, is just to reach out to somebody you think would be good, and
Okay,
we can have that conversation. So I'm very open to that as well. And we could actually do that anytime.
Okay.
You know what I mean?
Yeah, I
So
was gonna
just
say,
let me know if you think, or anybody, an educator that you'd like to recommend, just
so-
good. I thought of that earlier, Mike.
yeah, I
so thank-
just, since my role as educator is a little bit unique and the folks
Yep.
doing degrees, I want to make sure we have representation from the four-year schools, which is where the most of these are coming from. New
Yep.
applicants are coming from, so.
Okay, new item, syncing expiration dates for dual licensure. So this has come up a couple of times, we have, I don't know what it was, 14%, I had that written down somewhere, of all the licensees, or was it 8%?
It's about 8%.
8% of all licensees have 2 licenses. So the board had, kind of an interesting round robin about, now it would take a statute change to make this happen. So it's kind of a, it's a fairly, medium lift to actually accomplish this. But the pros and cons that have been discussed are things like, the pros are obvious. The cons are, some people don't want to have to come up with all that money at once. I don't know. I don't remember if there was another con or not. So I don't know. I mean, I can't tell. I think we talked about sending out a survey, right, David?
So initially it was thought.
Oh, that's right. Then it got pushed to us.
And
Yeah.
I thought,
Yeah.
they had this conversation
Yeah.
last board meeting that said the advisory committees could discuss it
Yeah.
representing the licensees.
Yeah. So, yep. No pressure. It's on you guys now.
Well, we
is
did
this-
lower fees, right? So fees have been
We did.
lowered. So that may take off a little bit of that. I know personally it would be kind of handy as a social worker and addiction counselor to have them be at the same time, so I don't have to try to remember them separately. Also to keep track of what CEUs count for both, right? So like I've got a little bit of overlap. So like, when do I need to do that ethics so that I can hit both licenses? It might be just a little bit easier in terms of keeping track if they were perfectly aligned.
That was going to be my question with the CEs, and because I have to look every time, and I'm licensed in multiple states, so I always have enough CEs because I'm covering both. But where can the overlap occur? And I don't remember what the statutes and regulations say about if you got 40 here and they all folks, can they be dual used if you're at the same time? Does that make sense? If they're
Mhm.
renewing all at the same time, can they count for both, or are we then increasing the number of CEs for these folks within a shorter period of time? Because there might be some overlap that they use if they're, on different years. I honestly can't remember because Missouri does it one way, you guys do it a different way, so.
My licenses are 2 months apart. I think I have an August or 3, an August and a November, and I use CEs for both. So dually, I use a CE if it applies and it falls within the right time frame for each of them. So I don't think for me personally it would affect a lot. In fact, I could keep track more easily about like when a year ends here versus the year for this next one and which ones have already been used for one last year and can be used, et cetera. So there's that piece from my perspective. Our employees, we actually reimburse them for their licensing fees. So from like our agency end, people wouldn't be affected by 2 licenses coming up at once because we'll reimburse them for that. So just FYI.
Seems to make logical sense to me too. It doesn't affect me personally. But Shane, we're kind of like you, and we have a reimbursement fund for that too. So, you know, and I think there's probably a lot of bigger organizations out there that do that. So
We don't.
well, nobody's going to go work for Johnson County then.
I can see why we have no applicants now.
That's right. They're all coming to me.
We help them get the addiction with, we'll pay for the test and we'll pay for all that initial, but there's no reimbursement for renewals.
I just wrote that down with a big black marker, Deb.
Hey, Deb, I know that there was a survey. So I guess what is the big concern? Because if you had to pinpoint it, because I have an LCPC and I also have my addictions. They are kind of like Shane's, very similar. They're about a few months apart the same year. So I always have to renew either in April or December. But I also am in private practice. And so obviously for me, my thing is I can write it off if I have to, get my CEs, but kind of like Dulcinea and kind of like with Dulcinea, a lot of it is kind of that personal responsibility with your license is you kind of have to keep track of it. I mean, it's not, once you get the license, it kind of falls on you to ensure and keep track. I think we've done our due diligence and we've done everything that I could think of to really ensure that we're being as feasible and as flexible, within the board to make sure that people can get it. But I also know, because maybe I'm really weird, but when you go through all of the people that end up getting in trouble or, on the naughty list, it's because they let their license expire. But I feel like you also get the notifications well before that your license is, coming up. And so if you are duly licensed, I'm pretty certain, and I can't really speak for everybody else, but I kind of feel like everything is, pretty well an oiled machine on knowing when you need to renew it. And there's tons of CEs that can cross over. I mean, ethics is one that is universal.
I'll say that I very much appreciate the reminders. Those are great. Those keep me on track.
Well, and if you have dual licensure like I did and let mine lapse because I said I would never need it again. Remember that one time? Then it's going to throw the cycle off again, right? Because they'll have a new renewal date. So I don't know that is significant or anything, but just an observation about it.
Well, this discussion is kind of like the boards. There wasn't a lot of fire in the belly. I in a perfect world, if someone was starting out and was going to have to, or let's say they're getting their second, to be able to have that option, I guess, might be good. I don't know that it's that important. It's just it was asked, I don't know how many people in the field that have the 2 feel that way. And so those of you that do have 2, I appreciate your input.
How long ago was it that we got the LAC? Was that 13, 14 years ago now? I don't even know.
Right.
It was 9-10 years ago. It was after I started.
Yeah, it was right around 10-11. You might be thinking when the bill was passed.
Oh, okay. So mine are exactly pretty much a year apart. So every year I have to renew one of them. So it is and I've managed it now for 10 years. And for the most part, it's worked out okay. So yeah, I mean, I think maybe an option. I don't know if that's something that would be a possibility of saying, I want to, get this license for only a year so that it will align with my other license and I can renew both at the same time. I don't know, a partial one for people that
it would have to be done that way, which then you'd have to pay more. So you'd have to pay more in that upfront because it can't be longer. It can only be shorter.
I can see how it would be, how it could be handy, but it's manageable.
It kind of feels like one of those, if it's not broken, don't fix it kind of things.
All right. So we have no recommendation then to forward. Good with me. All right, old business. So the board is meeting virtually tomorrow to kind of go over some big picture items, things that we might want to take in a legislative packet this year. So I do need, if we can, some specific direction. And I know we talked about these before, so I just want to reiterate it.
And Deb, just to clarify, the meeting is on Monday from 9 to noon.
What did I say?
Tomorrow.
Well, okay, guys. I have a sinus infection, so the brain is not working super well, as you've already figured out. So thank you, David.
It's an unusual. It's an unusual.
I wasn't going to be there regardless, so it's all good. Monday. We were supposed to meet in person, and that all got changed. So now we're going to do 2 virtuals. So good old COVID. Records from deceased practitioners. What I have in our notes from last time is that I think there was some interest in looking at that for the renewal. I'm not sure putting it in professional conduct is going to do much if we really feel serious, strongly about this. I like the idea of some sort of something you attest to or something. And I think somebody said something about you could actually put a line in there for like who or what organization would be responsible for your files so that there's some sort of record at that point. Which is every 2 years, which makes it fairly recent if something were to happen. What is our thoughts about a recommendation?
Well, and Deb, I can just kind of clarify that too, as far as the regulatory language, because there's the rules and regulations, and I think one of the ideas was before adjusting language on the applications, you may want to adjust that language so that it's clear that this is an expectation of practitioners. And then, so just kind of explain why that was maybe part of discussion.
Sure. I think it could also be something that colleges and universities, should be part of that discussion to make sure they're teaching to that.
I can only speak for what I do, and I think it probably comes up in passing as conversation from, the ethics and record keeping related to ethical responsibility for your records and that kind of stuff. I don't think it's broadcast clearly, and I'm old, so I don't remember that in my graduate work either. So I don't remember conversation about that. It was more conversation with working in private practice and talking to someone who set up the private practice and that they had put those things in place, because agency practitioners typically don't have to worry about that because the record is not theirs.
Right. And maybe that's another checkbox on the on the renewal. Are you in private practice? If so, what is your plan for the records in the case of your demise or retirement? I mean, it's all kind of the same. I think a lot more people, it seems like, are working, into infinity. They can do it virtually, bring in a little money. So that I think this is I think that's why it's popped up as more relevant. And it's a terrible position for state agencies to, and families or whoever to realize that we don't know the answer to potentially get those calls.
There are also certain situations where records could potentially be abandoned too. So that could be helpful as well.
Yeah, that's true. Who do we turn these over to? What happens? Blah, blah, blah. What do you guys think?
I think it would be helpful to include that question just so that people are thinking about it. Obviously, also having been somebody who went out and did programmatic site visits, people check a lot of boxes and say, yeah, I've got that taken care of, and then in practice don't. But I think that at least, saying that we're putting something out there to help people to think about it would be helpful, a good step.
I like the idea of a blank for them to type in, who or what entity or whatever.
So
Because that's an extra layer of, telling the truth.
just I don't know if this can be clarified or not. So we recommend that there's a blank put on the application, which quite frankly, I'm all for. I think it's a good idea. However, is there any binding element to that? I mean,
No.
like, hey, John
No.
down the street that's got a practice can take my records. Well, is there anything that actually allows John down the street to take the records then? I mean, what are the things that have to be put into place for a private practitioner to say this entity or this place is going to be taking custodianship of the records that I've generated? So, I mean, I guess I'm just trying to think of the step after, and maybe it
Well,
just
you're totally right.
General's office or somebody something to sink their teeth in to
Yep.
allow the records to go there if John will accept them. I
This
don't
is
know.
It's definitely a little cart before the horse, right? Because we haven't really taught people what that involves. So this would be a way of them kind of waking up to say, oh my gosh, I need to think about this. And they will come a knocking. What does this mean? What do you want me to do? I don't know what I'm supposed to do. I don't know the first step. Right. So I do think we have to think that through.
I would assume a minimum of a BAA agreement would have to be in place.
Yeah.
I'm not sure what else. I'd have to think about that.
Right.
Make sure I did it right when I did that.
I mean, this is, I don't know if the AG's office can help put something together about what's kind of out there or what kind of criteria might be useful. I mean, I don't know how helpful it is to have, John Smith be the person that said they do it. I even have an agreement with them, but then they flake out. So it's like, I don't know if there's like more legitimate, I don't know. Is it an attorney? Is it some sort of records keeping warehouse that is not as likely to disappear into the, I don't know.
That's interesting. I'm dealing with this right now in another industry, and it is the licensing entity that stores them when the business is closed out.
Yeah,
Well,
I think
and it has to be some sort of legalized process, because I think back to the organizations that have been closed down over the years for whatever reason. The KDADS has gone in and removed licenses. They've closed their doors, and and the state took custodianship of those substance use records. Because I know from our experience when we moved out to Western Kansas all those years ago and started doing services out there, we would receive subpoenas for records that we don't own. I mean, they're part of another organization, so those subpoenas would have to go to the state, who has taken ownership of those records at that point. That's what happened in that case. I agree. It feels a little cart before the horse to say, hey, let's make sure we get this name on an application and have people think that is all they have to do. Right?
good point.
I'm retiring. Sayonara, I'm walking out the door. John's going to take the records, or I'm not going to even bother. I just close the door and leave, and somebody finds them. I don't know. I don't know what the steps are, but I think we need to determine what some of those steps might be before we inadvertently put something out there that have people thinking that they've done something that they haven't.
It's a good point. So it sounds like we just need to have more board discussion, David, and possibly include the attorney.
Yeah, and I can forward that to the Attorney General's office, the ones who work with us, to kind of see what their thoughts are on that. I do know that, right now, currently, if a situation comes up where abandoned records are discovered, the Attorney General's office can go in. I think it's one of the divisions of their office, maybe Consumer Protection or another division, that can temporarily take custodianship of those records. They're not really a permanent or long-term group that would hold the records and respond to requests for individuals to see those records. That it's a fail-safe kind of thing right now. But this is hopefully something that would help out in most situations to avoid issues like that. But that is sort of the safety net right now, is the Attorney General's office. But yeah, I can forward the questions that you have had in this meeting and see if they have any thoughts on the next steps to really flesh out some of these ideas.
Cool. All right, next item is diversity, equity, and inclusion training. We were talking last time about potentially, if we weren't really interested in adding any more required, but if we wanted to drop 3 hours of the 6 of diagnosis and treatment and put this in its place, there was some interest in that, it seemed like. I know Christina, who couldn't be with us today, said she felt strongly for the need to have something around this topic. But I don't think she had any heartburn about reducing the others, so. Thoughts?
Deb, where did we end for the LACs, since they don't have the 6 hours of diagnostic?
Yeah, we'd have to talk that through. We could add it for them.
Okay.
I don't think we even talked about that particular.
I didn't remember it, but I couldn't.
Yeah,
Yeah.
it's a good thing to bring up, though.
From theoretical standpoint, I think it's probably warranted, all that kind of stuff. But again, we're, diversifying. Do we want to, is there a need to, are we seeing complaints or anything around that area that suggests there's an excessive need there versus continuing to boost that diagnostic assessment component, which is what that training is supposed to be doing, right? If we were to reduce it, we wouldn't want to have our assessments not be as good. For one, is it a trade-off? I don't know.
For me, the diagnosis and treatment of SUD has always been a little squishy to get a hold of. If you're focusing primarily on SUD, it doesn't take 6 hours unless you're really basic. So usually you're covering other things, and those other things are usually covered in other trainings that you get anyway. So I don't know, I guess that's my feeling about it for us, and I can't speak for the mental health professions. So not to say that there is an importance in going over those the most common mental health diagnoses as well, but hopefully they're getting some CEUs in that also. So for me, it always felt a little heavy. Like we're having to think up stuff to put in the 6 hours.
Yeah, I can agree with that for the LAC versus my other license. It gets a little bit harder to fill all of that time with something, whereas the other license, you're looking at the whole DSM. You can choose from a bunch of things, so that's a little bit easier for me to find.
Mm-hmm. No strong feelings, no consensus.
I agree that it's important. The training's important. I leave it up to you all that have to count the hours to know where to take that from and trust your judgment on that. But I do think that it would be beneficial to add it in some way or replace.
I think I'm going to agree with Jacqueline on that, just as I've since in my role, I do see what other states are doing, and that is absolutely included in almost all of the other SUD license certification process in other states. It's defined out as a separate category for them. So Kansas collapsed that when they did the licensure into it needs to be in everything, whereas most still have it separate. So it would make sense to have that as part of the CE requirement to me.
And this is like when we go to Relias Learning online, or I find different trainings to attend or CEs, it would be up to me to find something that meets the guidelines, true? Or is there something we're looking at that would meet this? Because the first question is going to be from me and everyone else. It's like, oh, how do I get this? How do I find it? Is it included in the online trainings my employer provides? Is it somewhere else? What fits the criteria set?
We'd probably need somewhere a definition of what that would include. What do we mean diversity, equity, and inclusion? Because if you're not an expert in that sub area of education and research and all that kind of stuff, it might be kind of confusing to many. To me, it would be, gender, ethnicity, socioeconomic status, sexual orientation, any of those would be put into that category. Urban versus rural, I think, could be put into that category as well, that kind of stuff. As far as it's the old special populations is what it is.
Yep. Well, I don't really have a good sense of where the board's going to land on this. So are you guys comfortable that if they decide that they want to pursue something across the disciplines, that we would coincide with that, as long as it's not adding, except for the LAC, we would add?
I'm okay with that.
Yeah, I'm okay with it, just to make sure
Okay.
everyone understands what it is when it's put out there.
Totally agree.
I think they're definitely going to, and I always feel bad that the addiction counseling is almost kind of like the redheaded stepchild, because all of the other licenses have been like established and have, had this across the board, like fluidity. And then the addictions, because when I started, it was, the just certificate, you're app certified. And then it was like you got grandfathered. So a lot of those people that were app certified didn't have the education. They just had the experience and then became LACs. And then we decided to, add more to that. So I think as long as we make sure that we are very strategic in wording and how we explain that, because a lot of those people that had, gone from apps certifications to LACs to, LMACs, like some people don't have a lot of those credentials or experiences that a marriage and family therapist or psychologist or professional counselor might have. So I think as long as we make sure that we are explaining every step of the way, the process and the reasoning and rationale behind it, I think it'll be fine.
Okay. Great, good work. Next item, in residence. In your information that was sent out, you have the education regs that talk about in residence. My notes here. So hopefully you had a chance to look that over. We asked staff to provide that for our discussion. Apparently ours is more liberal than maybe all the rest.
And that's what I'm remembering, was that the addiction side was more liberal on the in-residence, and it didn't have as much of an impact for the education and the educator side if that was changed. Because the changes that were being discussed by the board were almost coming in line with what we already have, if I remember right.
Leslie, do you feel like there is a need to change ours?
I think yours allows for mostly online education, which is what you wanted. So not really.
Okay.
Yeah, allowed for the practicum to be the residence, which made it pretty easy to put the rest of it online. So Okay.
Do we need to discuss it any further? Well, that was easy. Okay. Hopefully the next one is too, because I think we already agreed to this, but I just want to check in. Allowing individuals who qualify for LMAC to be LACs. So just to recap, the law basically, when we moved to LMACs, did not allow an LMSW to take the basic test, level 1 test, and become an LAC. It basically forces them to take the higher test and become an LMAC or not, or don't become anything. So I'm glad I checked this one out, because I actually told a staff member who was having trouble passing the test, hey, just take the other one. Oops, no, can't do that. So I guess in the interest of workforce, are we okay with allowing this and change?
I am. For sure.
Yeah, I am.
I am too.
Woohoo! All
You
right.
guys are good.
And then the last one is the one that Leslie brought to my attention. So I'll do my best to kind of explain it. I'll just read it. So in order for an applicant for a clinical addiction counselor to obtain credit for hours accrued before August 1, 2011, toward the required 3,000 hours of clinical supervision, the applicant shall provide an attestation that the clinical supervision occurred in accordance with blah, blah, blah. Same old stuff, right? So do we need the August 11th piece?
The requirements are less than the normal hour. The requirements for documentation are less than what we usually require.
Because it's August 21 of 2011. So we didn't want to preclude people just because they didn't have, it's kind of it's a tiny little grandfather clause is kind of how I see it. Apparently we don't use it hardly at all. Like no one asked for it. We're going into this reg. Which section is this?
It's subsection H.
Well, I know in what?
102-1-7-6.
Okay. So whatever that is.
I don't think
That's a
anyone
reg.
has asked to use it. And honestly, those hours would be getting a little old too.
Yeah.
They're
Well,
barely
we're
gathering.
dropping. So it was 4,000, right? Now it's 3. So
Right,
theoretically, there should be able to jump over that
right.
benchmark a little easier than they might have. So anybody, I didn't want to just say, I don't think we need it anymore without checking in with you guys.
I mean, it seems old enough. Actually, the only place that I could see that could reoccur would be somebody who might be coming out of state that had been practicing elsewhere and then returns to Kansas and has that issue because their stuff in Kansas was older. And I don't have good knowledge in my brain about how the wording for, other state kind of components plays when you start looking at, I know there's no reciprocity, but that would be the only place that I could see that would come up would be if the documentation is from, external to Kansas, but the rest of it should be pretty much anybody who would be 2011 and below 4 is probably already in the system if they're going to be licensed at this point. So I don't know. Go ahead.
Oh, I was just going to say, I thought we dropped some other grandfather clause recently too. I don't remember what it was, but something we had written in to allow for people. So thinking it again, we're 10 years out. By the next time we get into these regs, it might be another 10 years.
And Deb, these are for licenses or people who have had their license from August 2010 and before. So anything after August 2010 doesn't count, right?
It'd be 11, yeah. So anything after 2011. So this is just an allowance for people who got those hours prior to that point in time that licensure was enacted.
Mhm.
And what it essentially did was if they couldn't find their supervisor, they could get documentation of those hours from other places. Where if you do currently, I mean, they could count hours from 2011 if their supervisor can sign off on an attestation. This would just say they have to have the same documentation as everybody else.
You're right. That is the actual important part of that.
So the hours could be counted. They would just have to fall under a more strict guideline in terms of proving it than what is there currently. That's helpful. Thanks for making that clarification, Leslie. That makes much more sense.
Which is why I normally let her explain this stuff, and I don't know why I felt the need to do it.
Are you guys encountering much of that, having folks struggling to get the documentation of that supervision time?
No, not at all.
So do we feel okay dropping it?
I'm fine with it.
I think so.
Yes.
All right. Does that help, Leslie? You know what we're
Thank you
agreeing
very
to?
much. Mhm.
Okay. Anything else for the good of cause today?
Leslie, when you recall the previous grandfather component that was recently dropped, if you could let me know. Because if it's the one around the degree being awarded before 2012, I would like to know that. The research, it's not that one. Okay. Because I encounter that frequently with my folks who have degrees already, and whether they have to have that research class or not. And if that went away, if they got their degree in 2008 or whatever, then I would want to know that.
No,
Thank
that
you.
was fine. I think
Okay.
we actually dropped grandfathering.
Oh,
The
yeah.
overall
Last
grandfather.
thing we dropped.
Okay.
That was gonna be my next question, because I thought on the website, grandfathering is not even an option anymore.
No. All right, that's all I had. Do I hear a motion to adjourn?
I motion to adjourn.
I'll second.
All right, all in favor, say aye.
All right.
I
Aye.
Have a great weekend, you guys.
Thank you. Have a good weekend.
See you all later.
Thank
Hey,
you.
Hey, Lisa. Oh, she's out there.
not here.
Oh, if you get a chance, if you could give me a call, I'd appreciate it.
Yeah, are you in the rest of the day?
Yes, I am in the rest of the day.
Okay, will do.
All right. Thank you.
Bye.
Bye-bye.